If you are pregnant or you've recently had a baby, this podcast is for you. I'm your host, Kath Bequee. I'm a physiotherapist working in women's health and mum of 3. Inside my online program, Fitness Mama, I help women feel confident and strong inside out as they navigate pregnancy, birth, and postnatal recovery. Each week, I bring you 2 episodes to support you on your motherhood journey, whether it's real and raw birth stories from fellow mums, expert interviews with trusted health professionals, or bite-sized Q&As where I answer your most common questions. It is possible to feel amazing in your body during this stage of life, and I want that for you. Come and say hi on Instagram at kathbequee.physio, and let's dive into today's episode. Hello, welcome back to the Pregnancy, Birth and Recovery podcast. Today's episode's a brilliant chat with Dr Emily Rubinstein, who is a women's health GP based in Richmond, a Juno specialist, based in Richmond, Melbourne. And in today's chat, we discuss Hyperemesis Gravidarum and more broadly, morning sickness and nausea vomiting. So today, Dr. Emily shares some really helpful information about what Hyperemesis gravidarum is, how it differs from normal morning sickness. She also chats about when women might need to seek help. We discuss management options from medication to hospital care and also lifestyle strategies. So even if you've got morning sickness with generalized nausea and vomiting, there'll be hopefully some helpful strategies provided. We also discuss coping day-to-day with HG and the importance of setting up support systems too. So I really do think you'll find this podcast episode helpful if you are pregnant, if you've not been feeling amazing, or if you know someone who's got morning sickness or HG, please do send this episode to them, because I really think you'll get a lot of value and they will get a lot of value. Without further ado, let's jump straight into this episode with Dr. Emily. Emily, welcome to the Pregnancy, Birth and Recovery podcast. Thank you so much for joining me today.
Kath, thank you so much for having me. I'm so excited to be here having a chat with you today.
It's amazing, and I'm really excited for this chat. I haven't talked to anyone and no one about this topic on the podcast. So today, as I mentioned in the intro, we're talking about Hyperemesis gravidarum. To get started, Emily, can you please briefly introduce yourself and discuss do you see a lot of patients in the clinic with this situation?
So my name is Dr. Emily. I'm a women's health GP. I work at Juno Specialists in Richmond, and I see women and across all the life stages, including in pregnancy, and I also see children and infants as well. One of the beautiful things about the space in which I work at Juno is that we have the ability to do long appointments and care for women who have hyperemesis gravidarum, which we're going to talk about today, and to provide them with IV fluids and IV medications that may not be able to be provided in a regular GP setting. So for that reason, we do see quite a few patients who have experiencing this really difficult set of symptoms and situation during pregnancy. So it's become a little bit of a passion topic of mine. I've seen so many women really suffering and have maybe not been met with the most understanding and care from other healthcare providers who may not really know much about it.
Yeah, Emily, I didn't realise. I should have realised this, but you're right, because most women with this issue, and we're going to go go into this in more detail, but the general course of action, correct me if I'm wrong, but go to the GP, and if it's severe enough, you'd be admitted to hospital for drip. Is that IV fluids? Is that usually the course of action? So having your services there has been able to allow a lot of women to bypass hospital?
Yes, in some respects, if you can find a GP that recognizes just how severe your symptoms are and that you are needing IV fluid hydration, um, a lot of the time patients are sent to ED, and that
Mm,
ED may not be a women's health service, and you could be waiting for hours and hours to
yeah,
see
gosh.
some doctor and have that set up for you. And for somebody who is really suffering from fatigue, dehydration, vomiting, headaches, palpitations, a whole host of symptoms can come along with this. You're not in a good state to be sitting around waiting for hours in ED. Um,
Absolutely. Okay, Emily, let's start at the start. Again, so that we're all on the same page, could you please just, I guess, well, what is HG or Hyperemesis Gravidarum, and how does it differ from normal morning sickness?
yeah, that's a good question. And I think, there is no united definition of what it is, but most healthcare professionals will agree with a variation of, persistent nausea and vomiting caused by pregnancy, which has led to a significant reduction in oral intake, water and food. And usually there's a weight loss component as well. So maybe up to around 5% of your pre-pregnancy weight. Some professionals will say, you might have some electrolyte disturbance or some other, severe dehydration. But I think really the persistent nausea and vomiting and that weight loss that impacts your day-to-day function, where you're just not really able
Mm,
to do the things that you want to do the things that you need to do or you love to do. And it can be persist throughout the pregnancy. So not just the first
yeah.
trimester, which just, yeah.
Yeah, and that's not fun, is it? Like, bad enough in the first trimester, imagine it persisting throughout pregnancy.
Yeah. Or for a small proportion of women, that's the reality.
Well, how common is it?
I think it's somewhere in Australia I was looking at this the other day, about maybe 5% of
Yeah.
pregnancies. Yeah.
Okay. That's decent.
Yeah, it's not that
One,
uncommon or rare. And I
yeah,
wonder whether there is a bit of underdiagnosis in that area because there's just not such great recognition.
yeah, 1 in 20 women. Mm. And are there any known possible causes, risk factors, anything that might make a pregnant woman more predisposed to having it?
Yeah, so there's been a lot of good research that's been happening. There's been a lot of research recently into HG, and with like a lot of things in medicine, is likely to be due to lots of different causes, and there is likely to be a genetic predisposition. Um, More recent studies have hypothesized that women who are suffering from hyperemesis gravidarum make increased levels of proteins. They're called GDF15 and IGFBP7, if you want the technical terms, but these proteins are involved in the regulation of weight and appetite. And women who are suffering from HG have very high levels compared to those who have minimal nausea, vomiting, or no nausea, vomiting in pregnancy.
Mm-hmm.
So I think they're doing research into these might be biomarkers for picking up people who are likely to suffer from HG.
Yeah, interesting. And they don't know what would cause some women to have higher levels, just
So
as you
I
said,
think
genetics.
genetics, yeah,
Mm,
yeah.
interesting. I remember when I was pregnant with my third and I went for a GP checkup, and it was the first time a GP had said this to me, but they said, really look after yourself in this pregnancy. You've got two children, make sure you get as much rest as possible and try not, easier said than done, right? Try not to get too tired because that can increase your risk of the morning sickness.
Yeah,
What are your thoughts around that?
definitely. Um, even, yeah, milder symptoms of nausea, vomiting, or HG, we know that being fatigued can exacerbate symptoms and make you feel a lot worse. And like you've said, if you've got another toddler, older kids, or even a baby that you're caring for as well, sometimes that's even an impossible ask.
Yeah.
So yes, that can definitely exacerbate things.
And it's vicious, isn't it? Because let's say you have those issues and you're feeling nauseous and you're vomiting, and then to be told you need a rest, but then you can't get enough fluid and you can't get enough food and you can't rest because you're vomiting. Like it's a slippery slope, I imagine.
Yeah, and it's awful to see because I think that women do go downhill pretty quickly. It doesn't
Mm,
take long before you're feeling dehydrated and rubbish. I mean,
yeah.
you've got kids, you've had the experience of having gastro, and
Mm,
imagine, when you're dehydrated and your body's aching and you've got the headache and you've got no energy and you just like really struggling to manage any sense of parenting. Imagine doing that all the time,
yeah.
but also with the persistent vomiting and nausea.
Yeah.
I imagine that that could be a little bit of a scratch of the surface of what it's like to
Oh,
suffer from
absolutely.
HG.
And to think if you have gastro, sure, your partner, family can step in for a few days and help out. But if it's for a whole 9 months, you know, that's difficult to, oh, it'd be so difficult to manage. I touch wood, never had, or not touch wood, I'm not going to get pregnant again, but I never had anything like that. So, oh, I just can't even imagine.
Yeah, well, that is a big part of how we try and support patients or help them is to provide education to their partners or friends or relatives or family about how severe this situation is and how best that they can support. Um, and that you really, they say you need a village to raise children. Your
Yeah.
village has got to start early.
Yeah.
You got to
Okay.
recruit them early.
And I want to dive into exactly what you said. But first, a step before that, let's say a woman's listening today and she's had issues with nausea, vomiting, and she's becoming concerned. Like, at what stage should someone seek support, and who's the best person to speak to? Did you know one of the best ways to support your postpartum recovery is through exercising carefully during pregnancy and preparing your body for birth? And this is something we cover inside Fitness Mama. This is what fitness is all about with its physio-created workouts. We help you support your changing body during pregnancy, whether or not that's with pelvic girdle pain-friendly workouts, whether or not that's with strength training for pregnancy or pregnancy yoga. We help you to prepare your body for birth and reduce your risk of third and fourth degree perineal tears and episiotomy. And we help to boost your postpartum recovery, whether or not you've had a vaginal or a cesarean birth. If this is something you want to do, then come and check out our free 7-day trial. You've got nothing to lose, everything to gain. And at the end of the day, it's all about helping us have a better motherhood experience to help us feel stronger inside out in every aspect of our life: physical, mental health, confidence. Anyway, I could keep on going, but come and check out the link in the show notes and join our free 7-day trial. See you soon.
I think that if you've got any concerns during your pregnancy, seek support. Whoever your primary healthcare provider is, if that's a midwife, you go speak to them. If it's a GP, then that can be your person or a private obstetrician. And if you come in and you are explaining the severity of your symptoms and you're not getting through to them, ask somebody else, find somebody new.
Yep.
Because you should not have to, if women, like other areas of medicine, I think that these issues have been dismissed, underdiagnosed, and really not understood. And it may not be through the healthcare providers' lack of compassion for them, but they're just maybe not understanding how severe this is. And I can say that before I started spending a lot more time in the women's health, I didn't know much about HG. I think I only learnt about it because one of my best friends was suffering. And I was a GP trainee and I started looking into it. But this is not something that is taught in medical school. It's not something that I learnt about in my GP training. Through
Crazy.
experience. Yeah, crazy, but true.
Okay, well, let's go into potential management options. And like as we were saying off air, this is all general information only. And for people's specific management options, they need to speak to the healthcare provider. But what might options look like if a woman's sick and they think, okay, I'm really not feeling well, I'm going to go to my doctor. What's the potential? What can be offered?
Okay. So we always start with the more simple non-pharmacological interventions to help people. And we've already talked about making sure that you get as much rest that is physically, possible within the constraints of what your life looks like. Snacking regularly. So a lot of this stuff is going to be, sorry, I should preface this by saying a lot of this stuff is relevant to women who have morning sickness or nausea and vomiting in pregnancy that is not as maybe severe end of the spectrum is HG. This is all good
Okay.
advice that you can use, right?
Okay.
So snacking regularly on whatever it is that you feel like you can eat. We know that keeping something in your stomach, whether it's a dry cracker or something salty, kind of can slow down that feeling of nausea, and make you feel good for the time that there's something in your stomach. We might look at switching up your multivitamins. Um, so, of course, we want women to be taking the 150 micrograms of iodine and 400 micrograms of folate. But often women are taking multivitamins that may have iron or other supplements that could be exacerbating nausea, making it could be just making it more difficult. So we might
Like
look at, yeah.
like what?
I think a lot of the time removing iron can just make people feel a lot better.
Yeah.
So it really, look, this is something that you have to talk about with your doctor because women do have high iron requirements in pregnancy and they may be needing an iron supplement. But if that is not you, then that could be a potential option to, have a supplement without that or just sticking to the bare minimum of what you need.
Or could
Um,
you take away the iron like component just for a couple of weeks to get the nausea back under control and then introduce it again? Or does that just usually?
Definitely.
Yeah,
Yeah,
okay.
definitely. So for people who are feeling nauseated or having vomiting in pregnancy, but not this severe, that could be something that you do first trimester. And then, as your symptoms improve, if you're needing additional iron, you could always add that back in. So that's perfect.
Okay. Yeah.
Yeah. Um, I think that how do we manage it as well is, like I said, recruiting any supports of people who can help around the house, help with childcare, and that may look like outsourcing for some women. Um, what else?
Can
Um,
I ask about more complementary approaches, I guess, for want of a
yeah,
better word? I've
yeah.
heard things about, ginger, vitamin B6, acupressure. Like, what are your thoughts around those things?
Yeah, so ginger may be useful. There's evidence to suggest that it can be useful, but I know that if I would never suggest that to a woman who has HG because they'll tell me where to go,
Yeah.
because ginger just
Yeah.
isn't going to cut it. But for general
Yeah.
nausea and vomiting, it may be
Yeah.
worthwhile trying that.
Okay.
The B6, otherwise known as pyridoxine, I kind of see as medical management. So I will come back to that. And there is some evidence to suggest that acupressure or acupuncture may be beneficial to reduce nausea and vomiting. So if you are open-minded and that way inclined, it could be definitely something to consider. You
And there's some
touched already.
wristbands. There's some wristbands around, aren't there?
Yeah, yeah. I was reading something. You've got to wear the wristbands, I think the evidence suggests, for pretty much most of the day. But yeah, like those ones that you get for traveling as well.
Yeah, right.
So often see women wandering around the clinic wearing those.
Yeah. So it depends sort of how sick they are and whether or not they've got extra time to test these options. Is that
Well,
right?
yeah, and I think for something like wristbands, like, look, I said there's limited evidence, but you might not have anything to lose if you're
Yep.
in that state. So
Yep.
I think
Yep.
I
No
would
harm
try
done.
it. Yeah, no harm
Yep.
done. Exactly. No risk.
Yep.
And then medications. People are always a little bit wary about using medications in pregnancy, but there's there's a lot of medications that are quite safe to use during pregnancy, and we've got studies to support that they don't have harmful effects on the baby. You've already mentioned pyridoxine and B6. Lower regular doses of this does have some evidence, and often we'll use a antihistamine or a non-sedating or a sedating antihistamine to help with nausea and vomiting as well. So a medication called Restivit is quite commonly used.
All right.
Um, and then in terms of really kind of, there's lots of medications that can be used, and different combinations and varieties. It depends a little bit on the severity of your symptoms, what your other medical conditions are, allergies, and like all medications will often have side effects, and that can be something that needs to be carefully balanced and managed.
What would be, let's say someone's listening, doesn't have any medical complications, no allergies, what would be probably the most common medication that you'd trial first?
Yeah. So the most commonly used one is that Restivit or doxalamine, which is a sedating antihistamine. Um, in it's can be quite effective in settling nausea and vomiting, and it also has the added side effect, which can be useful for a lot of pregnant women, being a little bit sedating. So if you take a higher dose at night, you likely to be able to sleep through some of that nausea and vomiting symptoms.
Yep.
Sorry, I should maybe come back. Maybe we don't want you sleeping through the vomiting symptoms, but it relaxes you enough so that you're not
Yep.
as nauseated at night and can actually
Yeah.
fall asleep.
Yeah. That would be a definite benefit to a side effect.
Yeah,
I can
yeah.
imagine. Are there any other side effects that women that might not be so
Yeah,
beneficial?
yeah. Well, the fact that it's sedating is not also that is also
Mm,
part of the problem, because using it during the day can make, parenting or working quite
of
challenging if you're
course.
feeling tired. So we
Yeah.
try and maybe have really small regular doses during the day and a bigger dose at night. We may use other, and this is where it can become tricky. And the next step would be to consider something like metoclopramide, or potentially ondansetron, which are the little wafers that people might have used for other things or have seen friends who are pregnant using.
Yeah.
Um, I think that it's tricky because we often, as much as we're trying to slow down the nausea and vomiting, a medication that's great for that is ondansetron. However, it can have the side effect of constipating, being a
Oh, yeah.
constipating agent, and if you've been pregnant before or
Mm,
you're thinking about it, first trimester, and can be throughout the whole pregnancy. I mean, you would know about this. Constipation is a really
mm,
common issue in pregnancy, so we don't want to be
yeah,
exacerbating that.
yeah,
Mm.
no, absolutely. But if you, yeah, okay,
There are obviously, we need to provide women with information as well about potential risks on mum and baby during um, pregnancies. These medications, which one you choose with your doctor should be a shared decision-making process where you find out about the risks and the benefits of each one. And there's no one-size-fits-all approach, which is why maybe I haven't answered this question as eloquently as I would like to.
yeah. So, long story short, find a trusted healthcare provider where you can talk through the pros and cons of each medication. You've mentioned some of the common ones, um, which is great. It really isn't an easy fix, is it?
There is no easy fix, and there are more medications available, and some women will end up taking steroids or using other more high risk medications, but usually an obstetrician will be involved in that conversation at this point.
Yeah. And is it often a matter of trial and error? So you trial one medication, see how it works, see how your body responds. If that doesn't work, then trial a different one.
Yes. And that is so frustrating as well,
Yeah.
knowing that there isn't one thing that's definitely going to work, and you do have to go through that trial and error to some
Yeah.
degree. Yeah.
Yeah. But also good for women to know that it's not, it's also another reason to perhaps go and see your doctor and healthcare provider sooner rather than later, because it might take a few, what, days, weeks to find the
Something that works.
solution. Yeah.
Yeah, hopefully no more than a few days. But when
Hmm.
you're feeling sick, days
Yeah.
feel like weeks, feel like months and years, and we don't want to be mucking around too long, especially if somebody is not eating and, getting more and more dehydrated.
Yeah. You know what I've just been thinking when you've been talking about vomiting, you've been talking about the increase, like the side effect of constipation. You know where my mind's going as a pelvic floor physio, don't you? The
Pelvic
risks of
floor?
the pelvic, yeah, exactly.
Yes.
The risks
Yes.
to our poor pelvic floor. Not only is there a growing baby sitting on top of our pelvic floor muscles that's under a lot of pressure and stress and strain when there's nausea, sorry, when there's vomiting, but then if we add constipation to the mix too, um, so that is definitely an indication if there are any concerns after a period of vomiting or constipation, there's any concerns around leaking or prolapse symptoms, you might also need to get a physio in the mix too.
Yeah, for sure. And I'm always talking to women about getting a good healthcare team around them. And with HG or severe nausea and vomiting, it definitely will include a pelvic floor physiotherapist
Mm,
because we know that, like you're saying, urinary incontinence will is likely to happen with this severity, with that, growing uterus and that weight, which you know all about. To the point that when I speak to women about going out and about when they can get out and about, I get them to take a little kit with them, which will include, some wet wipes, maybe some nappy bags in case you need to have a little vomit, and medication if we're going that way, mints, and usually spare underwear.
mm, yeah. How often do you find women that didn't have any issues with their pelvic floor pre vomiting, like before this HG? Like, I don't know. I actually haven't read any research. I don't know I don't know what the stats are amongst, like, do you find it really common that women do have issues post a really bad, severe issue with HG, or do you find it's not common
Mm.
enough to, yeah, I don't know. Maybe
I
there's
kind
probably
of,
no research around that.
you know what, Kath? I don't know. I'd have to look into it. But I do know that definitely for women who have had HG before, this will be something that this will be like this. If it's their second or third or subsequent pregnancy, they'll be
Yeah.
all over this.
Yeah.
First time pregnancy with severe nausea and vomiting and HG, I don't know, but if it comes up, it might come up, and I will word women up about that as, if they've been having experiences with it, or I'll just tell them, maybe just take this sick bag with you and bring a pair of spare underwear. You never know when you might
Yeah.
need it.
Yeah. Yeah. So if you've got HG, once you're feeling better, once you're able to get out and about, maybe at some stage of pregnancy, no rush, but it might be touching base with pelvic floor physio. I didn't even think we'd be talking about that today. I should have thought that, but yeah, sad, isn't it?
Yeah.
It's just another thing to add to the plate.
Yeah. Yeah. So a pelvic
Yeah.
floor physio is someone that I would be suggesting as part of the team. And one thing that we haven't touched on, and I would be remiss if I didn't talk about it, is talking about maybe bringing a perinatal psychologist on board.
Oh, okay.
Yeah. Um, Women who have really severe nausea and vomiting or are suffering from HG, commonly, almost all of them will feel quite lonely and isolated, feeling a bit helpless they're not able to function, not feeling good because they feel so sick, and making
Feel
sure that
guilty as well with any toddlers or anything like that, babies.
yes, that comes up often. And um, if when you're feeling so low and so sick, it's not uncommon to start to feel quite depressed. And some women will even contemplate ending pregnancy.
Goodness, yeah.
And for anybody who is listening to this and is having those feelings, regardless of, you don't have HG, but you're nausea and vomiting and you're just feeling so sick, please, please, if you're having those thoughts, talk to your GP, talk to your midwife, talk to a psychologist, talk to someone about it. You're not alone. And these thoughts they're really, really common, and we can help. So I
Yeah.
have to mention that.
Yeah, no, thank you so much. You're absolutely right. It's super important. Okay, let's discuss. You touched on it before, and I want to circle back to it. You discussed ways that like how important it is for your partner and family to get on board to help, I guess, provide a bit of a village
Mm.
support network around you. Is there anything in particular that comes to mind when we discuss this?
Um,
How can the partner help?
yeah, I think first would be understanding, and knowing that this isn't just a bit of morning sickness. A lot of people feel like can a lot of women will feel invalidated, that people will come up, or their mother-in-law or mother or someone will say, oh, I was nauseated during pregnancy, but I went to work every day and,
Yeah, yeah,
or managed to wrangle kids, or those comments are not useful.
no, no,
So I often will try and talk to partners or relatives and just explain how serious this condition is. Um, and I will encourage people to get as much help as possible with the domestic load that they can. Having other people come and do washing, or often making food is a big one that for the family. So if you have aversions, and the smell of food is going to set you off, these women aren't in the kitchen. They might be lying down somewhere trying to get rest, and they're not able to cook or clean in the
yeah,
kitchen and do those sorts of domestic duties. So you need someone to help you.
yeah,
So partners step up. um,
absolutely.
yeah. And same with
And
like, carrying around children, wrestling nappies, wrangling bedtime, that sort of thing.
yeah, yeah. Um, what you just mentioned, again, I want to zoom in on it.
Mm,
We talked earlier about you suggested small little snacks, small little sips. In terms of food intake and
mm,
fluid intake, what would be your top few
mm,
recommendations?
okay. Whatever you like.
I
So
love
don't,
it.
whatever you like, whenever you like, and how much of
Yeah.
it you want.
Okay.
Probably often when people are feeling good, they can overeat and then feel sick later. So maybe not as much as you want. Um, but I try and tell women, don't worry about if it's healthy. Don't worry about if it's, good lean protein for the baby or it's not high fiber. Just eat what it is that you feel like. And at this point, I'm a lot less worried about um, dietary restrictions for safety in pregnancy um, because I just need you to pretty much have whatever it is that you
Yeah.
like. In terms of fluids, I always encourage women to experiment with what they might like. So some people really love to have ice cold drinks and find that more tolerable. Other people, they want something warm or room temperature. Slurpees are often a hit.
Mm-hmm.
Frozen Coke often can go down really
Yeah.
well. Uh, so,
What about
in,
electrolytes? Like, electrolyte drinks.
and things like
So many on
that.
the market. Yeah.
Yeah. I think that they're fine if you like them. But
Yeah.
again, I just want you to have something,
Yeah.
whatever it is that you like. Because
Okay.
we would much rather be having women drinking and tolerating their fluid orally. I would much rather do that than have to suggest that someone has IV fluid, and that happens. Yeah.
Yeah. Okay. Now, in terms of IV fluids, and again, I'm circling back on previous conversation.
Yeah.
At what stage, let's say a woman is vomiting all the time, but she's also drinking, like, and she's vomiting, and then she's drinking. At what stage would you think IV fluids might be helpful in this situation? What are the markers, I guess, that might indicate it?
So I think that's actually a really tricky question. And if you ask me versus another doctor, you might get a slightly different answer. Um, a lot of this will depend on physical examination. Um, it will depend on how well they're tolerating their anti-nausea medication, um, potentially blood test results, um, and how well they're able to keep on top of their losses. So if a woman is vomiting like 20 times a day, it's going to be really hard to keep up the fluid needed to replace what has been lost, plus give you what you need at a baseline for physiological health and function. So
Yeah.
if that woman is presenting as dry and dehydrated on clinical examination and we're not able to settle the vomiting, they're, not urinating and really this is kind of getting into more technical medical stuff, which I'm not sure how interested people are in, but they've got really kind of dark urine and yeah, it kind of looking really flat and dry, then yeah, we might do some IV fluids. But in general, we're always going to be encouraging people to drink as much as they can because
Yeah.
doing the IV fluids has risks and it's not sustainable. So if it's really women who have refractory symptoms and on the most severe end of the spectrum, they're admitted to hospital, they have PICC lines, they get parenteral nutrition. That's a whole other ball game. And that does happen. And that's well outside of the kind of thing that the kind of patient that I would be looking after in even a specialist GP land. That's really tertiary obstetrics admission.
So you're talking about someone who, for the duration of their pregnancy, perhaps, they might initially start IV fluids, then they go home, get dehydrated again, back in hospital, go home, get dehydrated. And it's like this ping pong effect, and they end up just staying in hospital for the duration of their pregnancy. Is that what you're meant?
So
Is that what you're referring to?
some people can end up in hospital for the duration of their pregnancy. That would be the more rare, but possible, that they're really not able to eat or drink anything. Some women will get a kind of more permanent IV line put in and then have a nurse come to their house every day to give them what they need. It's called hospital in the home. But you need to be linked up with the right obstetrics team for that to be happening. And the reason I'm not talking about too much, because that's not really the women who are the most sick in that situation. They're not the kind of patients that I would be looking after as a GP.
Yeah.
You need an obstetrician looking after you,
Yeah.
and a dietitian. They'd have a physiotherapist, psychologist, a big inpatient multidisciplinary team looking after those women who are very unwell.
Yeah, okay. Now, I had a question, and it was totally zoomed. I've totally completed all the questions I'd initially asked. Oh, that's what it was. If a woman's had really bad nausea, vomiting throughout one pregnancy, she then has her baby. I've heard a lot of women think, oh my gosh, I can't go through that again. But, then life happens, you're pregnant again. Is there anything, and I think I know the answer, but is there anything women can do to help potentially set themselves up for success second time round?
Yeah. I think it's get the right people around you before you get pregnant. Make a plan, get a team, think about how you're going to manage home, think about how you're going to manage work. You've already had the experience of knowing which medications may work for you, who and who you want or don't want to be a part of the team looking after you.
Yeah.
You just have your medication ready to go the moment you start to feel anything. If you're planning on, you get your positive pregnancy test. As soon as you start to feel something, you enact your plan.
Yeah. And you might not know the answer to this, but do women that have had it previously, do they tend to be more proactive and hence have a better experience? Or is that often not, like, does that happen?
Yeah. I I think it's mixed. I think that some I hope that doing a podcast like this and us talking about this is raising awareness so that women know that they can do something about it
Yeah.
proactively. Um, I
Yeah.
hope things are turning around and that people are having better experiences. And I have had patients who have said this was still really, 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 really hard, but it was way better than it was last time around because I had
Yeah.
the care and support that I needed. So,
Amazing.
yeah.
Okay, well, to finish off with, Emily, because I'm aware of your time, what's some final words that you might want to mention to anyone listening today who's perhaps, suffering from nausea, vomiting, unsure which way to go?
Okay. I think probably I'm just going to reiterate some of the themes that we've already
Yeah.
discussed, but that there is support out there. Find the right people, find your team. There is usually more that we can do to help, and that you're not alone in this, that there are other women who have experienced this, and this might be a good time to reference I think it's Hyperemesis Gravidarum Foundation Australia. There's excellent resources online, and there's chat forums where you can, get some peer support and speak to other women and mothers who are going through this with you or have been there. So I suppose that's my final piece of that. Yeah, it can be really nice to have that peer support. Seek it out through the foundation or even through local Facebook groups. Other women, the more women you speak to, the more stories you hear, which I'm sure, Kath, you can attest to. We're in it together.
We've had a lot on the birth stories section of the podcast. A lot of women with it.
I bet,
Thank you so much, Emily. How can women come and find you if they want to connect?
Oh, yeah. People can come and see me at Juno Specialists in Richmond, Victoria. My name is Emily Rubinstein, and I would love to be a part of your care team.
Amazing. Thank you so much. I'll put all those links in
Thank you for having me.
Thanks so much. Chat to you soon. Thanks for listening to the Pregnancy, Birth and Recovery podcast, brought to you by Fitness Mama, your app for home-based, physio-led pregnancy and postnatal workouts. If you found this episode helpful, please tap follow, leave a quick review and share it to your stories. Tag at kathbequee.physio. I'd love to connect and cheer you on. And don't forget to check out the free trial at fitnessmama.com/free to start feeling confident, strong and supported today. Until next time, remember, a strong body, a confident birth and empowered recovery is something you deserve. This podcast is for informational purposes only and is not a substitute for individual medical advice, diagnosis or treatment. Please consult your healthcare provider for your personalised guidance.